Assalamu alaikum. In my previous video lecture, I discussed about Parkinson's disease, its clinical features and morphology. In this lecture, I would like to discuss the drugs that are used in Parkinson's disease. But for their better understanding, I would start with explaining the dopamine synthesis first. Amino acid tyrosine is converted to L-DOPA with the help of enzyme tyrosine hydroxylase. L-DOPA is further converted to dopamine by the help of aromatic L-amino acid decarboxylase. This dopamine, it is loaded in synaptic vesicles and then released by physiological stimuli into extracellular space, and then this dopamine released binds to dopamine receptors on postsynaptic neurons. Excess dopamine either gets back into the cell or goes to glial cells via monoamine oxidase type B or COMT. Now coming to the drugs used in Parkinson's disease, first one is levodopa. Levodopa is a metabolic precursor of dopamine, and levodopa is used instead of dopamine itself because levodopa can cross blood-brain barrier easily. It should be taken 30 minutes before meal because proteins in the meal interfere with its absorption. One of the drawbacks of levodopa is that it faces peripheral breakdown. That is, levodopa is converted peripherally into dopamine via dopa decarboxylase and into 3-oxymethyl-dopa by catechol-O-methyl transferase. In order to avoid this peripheral breakdown, levodopa is administered with carbidopa and entacapone. What carbidopa does is it inhibits dopa decarboxylase, and what entacapone does is that it inhibits the catechol-O-methyl transferase, thus thereby reducing the peripheral breakdown. Now coming to the adverse effects of levodopa: nausea, vomiting, depression, loss of appetite, hypotension, mental disturbance, discoloration of urine, sweat and saliva, some arrhythmias, mydriasis, dyskinesia. Some important points to keep in mind while administering levodopa is that they are contraindicated with vitamin B6. Why? Because it increases its peripheral breakdown. Levodopa should not be administered along with monoamine oxidase inhibitors because it leads to hypertensive crisis. And the last drug which it should not be given with is antipsychotics. The next class of drugs is monoamine oxidase type B inhibitors. Their mechanism of action is that they inhibit monoamine oxidase type B, enzyme that metabolizes dopamine, and thus concentration of dopamine in CNS increases. The drugs included in this class are selegiline, risagiline, and sulfonamide. However, selegiline loses its selectivity if given in high doses. That is, it also then acts on monoamine oxidase type A receptors. Selegiline is, on other hand, metabolized to methamphetamines and amphetamines and thus produces insomnia. We should make sure that the drug is not administered after mid-afternoon. Adverse effects are nausea, insomnia, and visual hallucinations, dyskinesia, and hypertension, that is if selegiline is given in high doses. Next class of drugs is catechol-O-methyl transferase inhibitors. Their mechanism of action is that they inhibit 3-oxymethyl-dopa in plasma. Number 2, increase dopamine in central nervous system, that is by increasing the dopamine uptake. And third is they increase levodopa uptake by decreasing its peripheral breakdown that I've already discussed under the heading of levodopa. The drugs included in this class are tolcapone and entacapone. Adverse effects are dyskinesia, nausea, anorexia, discoloration, diarrhea, sleep disorders, hallucinations, and liver toxicity. Tolcapone specifically causes fulminating hepatic necrosis, while this liver toxicity it is less with entacapone, hence entacapone has replaced tolcapone. The next class of drugs is of dopamine agonists. Their mechanism of action is as the name suggests. They mimic dopamine and directly stimulate dopamine receptors in brain. The drugs included in this class are bromocriptine, ropinirole, pramipexole, rotigotine, and apomorphine. Adverse effects are nausea and dizziness, orthostatic hypotension, mental disturbances and confusion, daytime sleepiness, hallucinations, and constipation. The next is anticholinergics. Their mechanism of action is that they restore the balance between acetylcholine and dopamine by inhibiting the acetylcholine. The drugs included in this class are benzotropine, biperidine, procyclidine, and trihexyphenidyl. Adverse effects are constipation, urinary retention, dry mouth, blurred vision, mood changes, confusion. They are contraindicated in glaucoma, peptic ulcer disease, prostatic hypoplasia, and pyloric stenosis. The last drug is amantadine. Amantadine is an antiviral drug that was accidentally discovered to treat Parkinson's disease. The mechanism of action includes that it prevents dopamine uptake, thus increasing the dopamine availability, facilitates presynaptic dopamine release, hence more dopamine is released, blocks glutamate and MDA receptors, and blocks cholinergic receptors. Adverse effects are restlessness, agitation, confusion, hallucinations, orthostatic hypotension, urinary retention, dry mouth, peripheral edema, and acute toxic psychosis. Thank you so much. This was all for the topic of Parkinson's disease.